Hello everybody, I thought I would do this final update. This will be the last one I do unless, like I said, unless something crazy happens, which touch wood, nothing will. I had my 2 month post-op follow-up appointment with my surgeon. Um, if anyone who's watching this for the first time, I had a breast reduction and lift because I was suffering from a lot of chronic pain in my neck and shoulders and back, mainly my neck. And a huge contributing factor was my breast because I had severe sagging accompanied with a larger breast or cup size on a smaller frame. So it has been majorly helpful. The update the update on everything is that everything's very good. I'm now allowed to go swimming, be exposed to, like a swimming pool and the beach and so on. So that's really good. All of the incisions are still good. In terms of how things are healing, it's again just a very interesting thing to go through because there are certainly levels and phases through all of this. For one thing, even to this point, even 2 months after, there are still nights where I have discomfort when I sleep, or when I move in my sleep, or if I'm on my side for too long, because the breasts have become more jiggly, malleable. They move more, just like normal boobs do. Because when you first have your surgery, they're basically really solid. I didn't get implants, by the way, if that's of any use to anyone watching this. And so as they begin to go back to their normal form where they can move and everything, and the swelling goes down, that just means that there's a little bit more movement and pull on the incisions, and that can cause a bit of discomfort. So yeah, something I wasn't expecting there, but again, expecting, not expecting. I had no expectations. I went into this with a completely open mind. So that's something that you guys might want to take a note of if you're thinking of doing this. In terms of healing of around the scarring, the incisions, it's honestly incredible how you can go from looking like Frankenstein to all of a sudden you're the scars, especially around the areola area. It was all sort of jagged to begin with, and I was like, oh my god, is this ever gonna look like? Are these ever gonna look like normal nipples, like normal boobs? And then 2 months down the line, and you start to see how it heals, and you're like, okay. It's pretty amazing. I'm not sure if this is just to do with the way my surgeon did it, but the lines around the areola, you basically can't see them, pretty much. Even at this point, it's, yeah, you can see if you might have stitches that are still sort of poking out, whatever, like I do, which is normal, and they dissolve in their own time. But it's honestly they almost look like normal nipples. It's normal, as in it doesn't look like from the outside, it doesn't look like they've been cut, right? Doesn't look like there's been an incision unless you look really, really closely. And I was not expecting that 2 months down. I thought maybe in 6 months it would start to look like that. So that was a pleasant surprise. The bits under here though, ooh, yeah. It's the skin looks like it's sort of folding over where the incision is, and it does look very it still looks weird, and I think that's going to take the longest. And also on the sides here, I have to say, on the sides, it's weird because you can feel, I can feel the stitches underneath the skin. So it kind of the skin pokes out a bit more on the side here, and I can kind of feel the stitches more. Super weird sensation, and it makes me a bit self-conscious, and I'm like, okay, I got to be careful of that, even though I don't think anything can really happen at this point. So yeah, and exercise is still good. I'm also going to I've been going to a chiropractor to help address because I've been going for a holistic approach in regards to issues with my neck, because I knew it wasn't one thing causing neck tension. the general consensus, according to like what my surgeon said, what she saw, like very mild scoliosis, and then like my chiropractor as well. So it could be down to just like poor posture combined with, you know, having to compensate for like the level of sagging from the breast. So I've done most of I have 5 more sessions with my chiropractor, and then after that, he said, no, actually, he said to begin from this week if I can start going to the gym, which I'm like, I've been dealing with this with like the chiropractor, obviously the surgery, and doing yoga, and yeah, he says it would be good for me to start strengthening my upper back. So he's suggested doing like, you know, like the rowing and like anything that involves like pulling, like, I don't know. Anyway, so that's something I'll see if I can budget that for when I get paid for the month. And he said swimming is really good as well. So, well, swimming, I don't know about swimming. I'm trying to think if I've left anything else out. So we talked about the appearance, the sensation. Overall, they feel amazing. Again, like I said, with walking, I have no issues with walking now. I don't get negative consequences from walking. It's incredible. For any women who have like severe sagging or very large breasts, like you know, that's something that you might understand, which is that like going walking might be something that was like a shit, do I do this today and then suffer the consequences of this, or do I not, right? So it is such a blessing, such a huge blessing to be able to do that. Something as simple as going for a walk without it causing extra tension and extra pain. Such a blessing. So yeah, so grateful to my community and my family for helping out with raising the funds for that. You guys are my angels. Thank you. And yeah, I think that's all I have to say on that. I'm still in 2 minds as to whether I'm going to do like an overall sort of summary video from beginning to end. I think if I do that, maybe I will do it a year down the line, and because I think I'll have to like do a refresh of what it was like from the beginning, look back on my old videos, write it all out, do like a timeline, and that way I can do like an in-depth video on what recovery was like from beginning to end. So yeah, any questions, please drop them down below. Follow, subscribe. I don't really post content here apart from like the odd clip from my Twitch channel or just like updates on this. So if you do fancy chat, follow my Twitch channel. I look forward to seeing you on there. Otherwise, I'm happy to answer any questions down below. Stay awesome. Bye bye.